All right. I think I'm back. I think I saved the title, but I'm not even sure I saved the title. How are you
Overland
guys?
Bound Live with Overland Bound MD COVID-19. That's the right
Right on.
title.
Okay, good. We did save the title. Hey, thanks for your patience, you guys. And we are, as I mentioned earlier this week, we're doing quite a bit of content to stay connected as a community. Tonight, Chris, thank you. Chris is going to talk about what we're all facing, get his perspective on it. You guys know Chris is a trauma surgeon and our medical advisor. So we're going to talk about some best practices. And Chris, I'm going to ask you to do a bit of an introduction. Corey, did I miss anything?
Let's get a few people in chat to confirm that we're good on sound,
Okay.
because that's always the
Always,
technology variable.
always tricky. All right. So when you guys get a chance, please confirm that audio is good. Chris, why don't you give us a bit of a background and
Okay. As you guys know, so I am the medical ambassador for Overland Bound. So I handle everything that's related to medical training, content, and whatnot for the channel and for Michael and Corey. And personally, I'm a trauma and acute care emergency general surgeon. So we handle whatever comes into the ER, short of a few things. And I've been doing that for a long time. And then flight. I'm the medical director for the flight medic program for East Bay Regional Parks here in the Bay Area, and a couple other titles at work. But more importantly, put on the new task force for the COVID-19 at my hospital due to some of the training and titles that I have. So yeah, that's the short list.
thank you. Thanks, Chris.
Yeah.
So why don't you start with an overview? I'm sure we'll have some questions, but why don't you start with an overview of what you're seeing and your perspective on what we're all dealing with?
Sure. So what we're dealing with is, it's obviously become a pandemic, which is just a worldwide rapid spread of an infection. It is a virus. It is from the group of the coronaviruses. Um, so it's a virus that we've known about in the family style, but this is sort of a new version of it. Humans haven't seen this one. This one's called COVID-19. So we have no natural immunity to it. It spreads multiple different ways, and we're learning more about it, and we're learning how long it really lasts on surfaces and what that really means for infections and what that means for um, transmission and who's likely to get it. But as you guys can just see from the news, and if you were to track it, it spreads rapidly. It's already across the globe. I think it's in 175 out of 190 something countries, and it's still ramping up in a lot of places. So what we are seeing kind of internationally and nationally here in the US is just all what we would expect from something like this. And that's the hard part, is that we know that these things happen. Um, but the speed in which it attacks people and the severity in which it takes them down is kind of overwhelming us medically in the community. So far in the US, Washington and New York are the ones that are taking the big hits. California's right behind them, unfortunately. And we are on par to be like all of those places, like Italy and you see in the news. So um, that's kind of the intro to it.
Got it.
Yeah.
So we're all sheltering in place. That's what we've been asked to do. What are your thoughts on first? What that helps, how that helps, and we can have a follow on question after that. But why are we doing this?
So, sheltering in place, really we're trying to limit contact from people to people because this spreads person to person. And what will happen is by staying away from people, you actually prevent or limit the spread all at once. And we are seeing that when people are in close contact, we have a lot of cases all at once. And if they're not severe, but they're still coming to the hospital, they're overwhelming. They're overwhelming the medical system. So if we here's an example by number. My hospital has 155 beds. We service a 300,000 person community. If you take 1% of that and they show up at my hospital at once, we're overwhelmed. So what we need are for people to stay away to slow the spread. We don't have a cure. We don't have a treatment. And by staying away from people, you will slow the spread of this, which means that those people who do get sick enough to come to the hospital, and we'll talk about that in a little bit, the difference between why you should and shouldn't go to the hospital. But if we can slow the people who come to the hospital and slow that surge, that wave, then we can actually respond to it better. Um, if we get overwhelmed and all of our resources go down in the first 3 or 4 days, then that's kind of it. People who show up that would be otherwise survivable are not, because we don't have any resources, specifically ventilators if they need it. And it also affects all things that come to the hospital. So heart attacks, the need for emergent surgery, strokes. If our system is overwhelmed, people that were otherwise we could have saved, we don't have the resources to even save those. So it'll affect all disease processes. Um, but so that's why we do it. We want to limit that, and we don't want people to get sick. So stay away from each other.
Michael, your mic needs to be closer or be turned up much softer than Chris. Justin, let us know if this is better.
Great. Copy that.
I'm watching from here.
And I'll try and turn this up. Turn this up a bit.
Ooh.
Thank you for letting us know. And I hope that's better.
Okay.
Okay, so Corey, you mentioned something just before we got online, which was what's the simple thing of washing your hands.
Hold on. So Sergio Pedro has a comment, and I think it's important. Why go to the hospital? You just told us we have no, I think, effective meds to deal with it. So why would somebody go to the hospital then?
So to talk about that. So without downplaying the severity of it, the symptoms for most people are like a really bad flu. So what's going to happen is you're going to get a cough. You might have some shortness of breath. You might have fevers. You're just going to feel miserable. Sore throat's one of them. They're now thinking that GI symptoms are kind of going along with that. So you might have diarrhea, an upset stomach, but we don't have a treatment for this, meaning we don't have a medicine to give you to make you better. Viruses are tough to treat in general. What we do if you get severe enough is we actually support you. So that's either oxygen, IV fluids, and or ventilator or mechanical breathing, life support. So if you are sick, but really just miserable and not actually dying, being at home is the best place for you for a lot of reasons. One, if you really just have the flu, which we are seeing because the symptoms overlap. So we're seeing a lot of people that we rule out for COVID that are actually flu positive. So if you just have the flu and you're pretty miserable, staying at home will keep you from getting COVID-19 on top of it. If you are positive for COVID-19 and then you come to the hospital, but you're not someone who needs to be admitted, you're going to expose everybody at the hospital to it. And that's a problem. So it is really stay home, do your best to take care of things. Of course, if you feel like you are in serious need or serious ill past what you're capable of being at home for, comfortable at home for, then come to the emergency room and let us evaluate you. We do appreciate, and this is for all emergency rooms worldwide, if you can, we appreciate a phone call ahead of time. A lot of us are getting kind of triage tents in place to deal with people, but if you can let them know you're coming, it helps. But yeah, that's why.
Hey, here's a basic question. How are you? How are
Me?
you doing? Yeah.
Hanging in. We don't have a surge yet. We're starting to ramp up the number of positives and rule outs at my hospital. We are doing our best to secure supplies with the initial scare and just the basic resources we have. We're actually pretty low on things to protect the frontline healthcare workers, the nurses, the docs, EMS workers are even worse off than we are when it comes to frontline stuff. And we know from talking to our colleagues that the medical field actually is pretty small internationally. We all know somebody somewhere across the globe because of conferences and specialty training and whatnot. And we know it's coming. Everybody that we've talked to, you can just, so that anticipation is it's hard. So we're hanging in. I'm hanging in, but we are anticipating to be overwhelmed probably in the next week or two.
see. I'm going to go some questions here.
Yeah.
A lot of hellos. Hey Ryan. Hey Lewis. Hey guys. Okay. Here's a basic question. Why is soap and water the most effective thing possible for keeping yourself germ-free?
So it's actually kind of neat, biology, biochemistry, and micro that goes with it. Most bacteria and viruses, and especially this COVID one, as they go through just life, if you will, they actually pick up grease as a protective armor around them. And when you use soap and water, you break the grease down and then the virus is exposed, and then you basically just kill it. It can't live like that. So washing your hands is the way to go. Hand sanitizer, of course, works, but the thing about hand sanitizer is it's good, but not a cure all. It's great if you don't have access to soap and water. We use it all the time, but certain things, and not this one, but other diseases have spores that hand sanitizer doesn't work on. So you have to wash your hands. So washing your hands, 20 seconds, and it has to be 20 seconds in between the fingers, back of the hands, coming up the wrist a little bit, because a lot of people, their watch is still there. If you're really worried, take your watch off while you wash. And if you can, if you wear a wedding ring, take your ring off, because it will stay trapped underneath you and you can't get a good clean. So I usually just pull it forward a little bit and then wash and then put it back. But 20 seconds is a long time to wash your hands. People aren't used to it, but that's why. It just kills it, and then you don't transmit it.
Okay. And also, we talked about this earlier. Michael and I are sitting incredibly close to each other, but we're also sheltering at home together. And is it that you have to maintain 6 feet from everybody at every point in time, or can you still maintain a level of contact with your loved ones if you're sheltering at home with them?
So being at home and being close is fine. It's really just being out in the public that you want to avoid spreading, because the reality of containment in a house is zero. You just can't. You just can't contain it. You can't, you just can't. So, but depending on how many people in your household, that would limit exposure. If it's just the two of you, then it's just the two of you that get sick. If you go out in the world, you don't realize, but it's thousands of people every day that you come in contact with, or contact with something they've come in contact with. Think about a door handle. We know that it can live on certain surfaces for up to 3 days. We don't know how viral it is for full 3 days. But if I were to cough on a door handle and then 1,000 people go by, they've all been exposed. By not going out, you don't have that. Social distancing, 6 feet is the recommendation. That's just healthy people. If you're in the area where somebody coughs or sneezes, it needs to be bigger. But at home, you can just you can be next to each other. And then there's a psychology to that as well, being at home, which we can talk about, and I think it's part of the plan. But sheltering in place is going to be tough in general. Being stuck in your house with the same people, and we'll talk about some ways to make it better. But yeah, close contact at home is fine.
Okay. And then I'm going to go right into it. Sorry, they told me my volume was soft. I'm like, in your business. It's a great question relevant to this channel, and it is from Sean. Would it be safe to take a day trip to the mountains alone, or should it be held off?
So really, it should be held off according to our shelter in place here in California, and most states that are going to follow that, as well as internationally shelter in place. Because in order to go from A to B, it's not A to B mountains, it's A to whatever you need to stop in the middle, whether it be gas or convenience stores or food stores. So per the mandate that we have, it would violate that mandate. The actual risk is probably pretty low, but if one person does it, other people will do it. So it's really hard to keep the containment. So it's not something I could recommend as much as I would love to. So yeah, that's the answer. Unfortunately, is don't do it, but I can't stop you.
Okay, and then a follow-up question being, should we take off shoes or change our clothes after we go outside or take a hike?
If you are walking around your neighborhood or you're just doing something local and not going into like a public place like a store, no. It's really just not out in the air. Otherwise, they would tell everybody to stay in their house. If you go to the grocery store and you don't have a lot of particular contact and people are really limiting themselves and you maintain your distance, you're probably also still safe to stay away or to keep your clothes and not have to wash them. If you're extra paranoid, then sure, take them off and wash them. Shoes are shoes, right? They should be considered dirty all the time. But it just like I leave my work shoes at work and I change my scrubs before I come home and I go right to the shower. But I'm also at work where we have positive patients and we know it's around. Um, so, but otherwise, most people are fine.
Okay. I'm just going to keep going. Sorry, guys. I know
Yeah.
you're saying my mic is soft. I'll try and project. The one here from John Davison. Once you have it and are recovered, is your immunity sufficient to help others who are known positive?
So, yes and no, but realistically, no. Um, we are starting to see people who we think are being reinfected and getting it a second time. So, we're not sure what to do with that. Your own immunity is not necessarily enough to go help the people around you. There is a phenomenon of what's called herd immunity. Once you get to enough people who have had it, the rest sort of develop a mini immunity to it. But it's a large number. In the US, it's like 60% of the population has to get it before the herd immunity starts to pick up. So I would not say if you've had it that you should go hanging around with other people for a lot of reasons. We just don't know enough about it right now.
And then, so I have a very specific question for myself then. And it's tagging on to Justin's. Justin has another comment. I take care of someone immunocompromised. I shower down in the locker room before coming back into the condo. I Lysol my shoes and let them dry outside the door. What else should I do? And I'm tagging this in for me too, because, I take immunosuppressant drugs and have to be extremely careful of who and what I come into contact with. At what point is enough? Is there always something more you can be doing? Because that's how I feel. And that feeds into my, like a little bit of anxiety is what else can I do?
Right. So it comes down to your personal level of caution, and that's the unfortunate thing. There's a lot that can be done, but the reality is basic steps. So if you are already practicing social distancing and you really do not come in contact with people between your house and then especially going to care for somebody and you're already taking those steps, it sounds like, to prevent transmission, that's really about it. Excuse me. Unfortunately, there are asymptomatic carriers that have no symptoms and feel fine, and therefore we don't really know what to do with them. In that case, if you're really worried, a basic surgical mask will be fine. An N95 is unnecessary, and it's on my list to talk about N95 versus surgical and who needs them. But if you're worried about it, wearing a mask, a basic mask, is fine, and that will help prevent it because really it's spread from the respiratory tract. And unless you get the viral particles all over your clothes, you're not going to spread those. So, those steps that the guy who asked sounds appropriate. And then for you, Corey, it's just you got to really avoid who comes and goes and really know where they've been.
Okay, go after the face mask conversation because it ties into the panic buying hoarding that's prevalent and how to calm down, which I will segue into a mental health question, but let's talk about face masks.
Okay. So face mask. Here are the recommendations for face mask. If you are symptomatic, you should wear a basic face mask, not an N95. It's unnecessary. All you're trying to do is prevent the virus from coming out of your mouth and getting onto things. If you are not symptomatic and not around people, you do not need a mask, period. An N95 is to be saved for the healthcare workers and the EMS workers who have to come in close contact to care for patients who are suspected of having it or known to have it. Period. That is it. So I will ask those people who have hoarded or happen to just have a ton to take those masks to their local fire department and give them to those firefighters and paramedics who need them, because we are seeing positive cases in our EMS workers because they don't have the protective gear. And there's going to be a few soapbox moments about protective gear and what the hospitals need. So you guys may hear some of that. But our firefighters are and EMS paramedics and our nurses are frontline. They are the ones who have to go see that patient before they know anything, and they don't have the proper protective gear. So please, if you have some, just walk down to the fire station and give them to them. You don't need an N95 mask. If you're worried about being out in public, a basic surgical mask is sufficient but unnecessary.
Okay. I'll just say it again for the people in the back. If you have the N95s hanging around, actually, I read an article that a lot of people in woodworking have been, just over time collecting a bunch, and there's a huge movement of them taking masks to hospitals. But you're saying, go ahead, fire department, just get them in the hands of the people who need them.
Yeah, we had an elderly lady bring us 4 that she happened to have, just to help.
So 4 is a lot.
We'll take whatever we get. They are technically single use. To put it in perspective, they are already reusing these masks internationally. In my hospital and most hospitals in the US that are faced with this, they are designed as single use mask, and you're asking us to reuse them. That is where we are at.
There's a lot of good questions coming in. There was one earlier about what do you do for mental health when you're separated and isolated?
So that's a great question. Is definitely something I want to talk about. So health in general, mental and physical, need to be part of shelter in place. Physical is easy. Do something active. Dedicate a minimum 30 minutes a day to either do calisthenics or just walk around your house. And if you can't go outside, or just do something athletic, do something exercise based, and do that with everybody in the house. Make it together. My wife and I get the kids and we do stuff together, because there's lots of stuff online now that you can just do your workouts. Mental health wise is a lot tougher. Social isolation, social distancing creates a lot of problems with mental health, especially people who are elderly and are already kind of alone. Technology is where you have to go. We are currently live. I'm not next to you. I'm in my room across the way. I FaceTime my parents who are in their 70s every day so they can see the grandkids. The kids can do it on their devices. When I've been at work, I make sure I FaceTime them to make sure my wife is doing okay. And so take the technology, whether it's phone calls or video, to get out and talk to somebody else. Just see how everybody else is doing. And you'll see everyone's in the same boat, and that tends to go a long way. The other thing for mental health, if you are in a house with a bunch of people, you and your partner have to figure out how to take care of each other. And that's going to be some alone time. And it doesn't have to be scheduled, but you may have to look at them and say, I need 20 minutes where I don't have to deal with the kids, or I don't have to do anything. And go take your time, because you're going to have to go sit in a room and decompress, whether it's just take a shower, take a bath, surf the web, do whatever. But you have to have your time to process everything. You can't be on call for your family 24/7. We see this when people come into the hospital and they're super sick in the ICU, and the family wants to sit there at the bedside 24/7. And I admire that, but you will not tolerate the marathon that we are in if that's the condition you're in. So set aside time for yourself. Set aside time to be with your family. Mental health is just reaching out, talking to people. If you're in an apartment, yell through the door. Open the door and you're 6 feet apart and talk to each other. Look at Italy. They're singing on the balconies to each other to be still a community. So you really have to take care of each other. If you've got an older person that is alone, reach out to them. Ask if you can help them. See if you can be the one that goes to the store for them, because they really shouldn't be going out. Mm-hmm. So it's really going to take a community to make this okay for everybody.
Chris, I want to mention
in the mic.
Okay, thank you. I want to mention, we have if you go to Rally Point now, we've got the appropriate disclaimer. You guys shouldn't be using it to get together, clearly. But many of our members use it as a way of coordinating online events. And for that reason, it is still active. And we've got a number of online events throughout the country. So we are looking into making that available to everybody, and use that to create within our community an online event as opposed to going out and grouping together.
Okay, there's a theme of questions here. John Reynolds, how about rideshare drivers? What about people working at supermarkets or banks that work with a lot of customers? I've asked the staff at our bank. I saw them, and I just have profound respect for them showing up and doing the work that needs to be done to keep the country moving. What are just basics? Can you help them address any fears they might have because they come into contact with so many strangers in the general public?
Yeah, again, do your best for distancing. I mean, obviously, it's not always a perfect situation. Minimize contact with things. Unfortunately, money is considered a possible carrier of this as well. So if you're going to be handling money, I do recommend you wear gloves and do a really good job of not touching your face with the gloves. Most people are unaware that they touch their face very often. Actually, one of the caveats to mask wearing is if you're somebody who touches their face a lot, wear a mask so that if you touch, at least you're touching the mask. Obviously, don't be afraid to speak up. If somebody is coughing in your vicinity, take care of yourself. Speak up. Ask them to cover. If they're not covering, ask them to, maybe step back a little bit. Times are different now. I grew up shaking people's hands and looking them in the eye. And when I meet patients, that's what I'm used to doing. And I don't do that anymore. And I tell them that's not what we're doing right now. And people get it. This is global. This is not a local custom. This is now global. And I think that for those people on the front lines, again, obviously, much respect for people who have to go to work and doing their job, and you got to take care of yourself. So, gloves, protective gear are totally appropriate. But again, you don't need an N95. A basic mask will be fine. And then wash your hands, soap and water. And if you're at like a cashier and you don't have soap and water, hand sanitizer. Like, we really need to provide for those on the front lines. It's not just doctors and nurses and EMTs and firefighters and police officers. It's those people that you spoke of. They need to have that hand sanitizer. So soapbox number 7 or 8, whatever we're up to right now, if you've got 4,000 cases of hand sanitizer, go drop those off somewhere too. Give those to, when you go shopping, bring a case and give them to the store for their clerks. Again, it's community. We have to take care of each other.
And then DVS Rio, good reminder. Reminder to clean your phones, steering wheels, shifters on top of washing your hands. Absolutely. These things can be so gross. So
little petri dishes.
Yes. Have to moderate. Okay.
Chris,
yeah.
What else do you think? Is there anything else you can think of that we should cover? Maybe some wisdom you've gleaned over the last couple of weeks or what have you. Maybe dispel some misconceptions. What else do you?
I got lots of stuff, but let's. One thing I want to talk about are kids, because everyone's worried about their kids. Kids are doing well with this, so if they get it, it tends to be mild. I think we've had one death internationally under 10 is the last stat I read yesterday. So that's, as things go, really good. The thing about parents and kids right now is that there's no school, and there's probably not going to be school for the rest of our year here. Probably, and I think that's going to be probably worldwide. So parents, give yourself a break. You don't need to teach these kids 6 hours a day. Okay. I was reading up on this.
What?
Go ahead.
I don't have to?
No.
We don't have to? Okay.
No. So I have a 6 and 8-year-old, as you guys know. We've read up on this. The teachers are doing a great job of sending out curriculum to keep them occupied. Your kids go to school for about 6 hours a day and they're in a class of 25 to 30, and the teacher has to teach all of them at once. If you dedicate an hour in the morning, hour in the afternoon, most kids, that's enough time for them to keep up with their academics. We're talking like 2 hours a day. That can be one-on-one, that can be individual, give them assignment and then check on it. For working parents especially, that's going to be really, just give them something. And then the big one that's going to blow people's minds, screen time's not that big a deal.
What?
Yeah, screen time's not that big a deal. What screen time limitations were really put out there for was the mind-numbing boob tube TV stuff that they just sat in front of and did nothing. Nowadays, with academics, programs, and even some of the video games that require creativity, and they're not just mindless joystick controllers, the pediatricians are, especially in this situation, are saying, don't worry about it. Try to get them outside, try to get them to exercise, but do not feel that you have to have them at a desk 6 hours a day trying to crank out their ABCs or whatever they're working on in order to get through this. A couple hours a day of academics, more if you want them to, less if you just can't get to that, and don't worry about screen time.
It's been, so just on a side note, the school district here has actually sent several messages basically telling parents to calm down.
Yeah.
Get your kid outside, social distance, all the things, calm down.
Yeah. Yeah.
It's much appreciated. Okay. Hey, the good news here is we have almost the numbers of people watching just keep going up. So I think this is clearly relevant and necessary. So I'm going to keep, if it's okay with you, I'm just going to keep feeding the questions that are coming in because I want people to have direct access to an answer.
I don't exactly have a whole lot to do right now.
Okay. All right.
Sheltered in place,
Okay, here we go. Greetings from Estonia. Question. My wife is pregnant and the due date is in 1 to 2 weeks. What is known about COVID-19 in infants? What are the risks?
So we are seeing babies born positive. But again, going back to a couple minutes ago, kids seem to do pretty well with it. Less severe symptoms, tend to get through it without a problem. And the mortality rate is almost non-existent. So it is scary times, and I respect that. But, at least for the baby, mom should do okay. But for the baby, they tend to do fine.
Okay. And JD says, don't share joints or other smoking implements.
You shouldn't be sharing anything.
Puff, 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 puff all you want, and you don't have to wait for them to pass it back.
Thanks, JD.
Okay. This is good because I got this too because the Facebook newsfeed, one of the most academic, scholarly resources for people to use, JK, help us out with the ibuprofen issue.
So ibuprofen and all the anti-inflammatories take away the body's inflammatory response. What we're seeing is that it may actually make the COVID inflammatory response worse because your body's not able to fight it. It's an interesting kind of loop. There's a lot of science behind it, and we like physiology, but we don't actually know the real pathways that are being affected because it's too early in the disease for us to know, and we don't have the time to study it. But right now it is considered something you should avoid if you have those kind of symptoms, because it can lead to worsening of the disease, more lung scarring called fibrosis, and ultimately worse outcomes.
Okay. Okay, here's a very specific one from Computer Cowboy, and I'm going to butcher the pronunciation probably because I'm nervous. Have you seen the epidemiology data science write-up from Thomas Puello on Medium? As a trauma doc, what's your take on it? That's assuming you've seen it.
I'll Google it real fast. and I'll let you know if I've seen it or not, because
Okay.
it doesn't sound familiar. But I've never been good with the names of people who write stuff. Okay, what was this again now?
Thomas, P as in Paul, Ueyo, and it was on Medium.
Pueo.
You can bookmark that.
Yeah, I'll get to that. We can keep talking.
Okay. A couple of comments, not questions, that we appreciate. Like Overland community, respect and care for others. Not about me, about we. Totally agree with that. And thank you for the live OB time. Finally, some level-headed advice. This is your opportunity. We're really going to answer as many questions as possible. And Chris will be the first to acknowledge what he doesn't know, and we'll address what we do know or what Chris knows head on. Yes, don't forget to hit the thumbs up. Thank you, Jay. Like and subscribe. Let's see. Oh, interesting. Peyton Myers. Anyone looking to study up on their ham license? Ham Radio Prep site has their $50 class down to $10 just for this pandemic. Little shout out and savings.
Yeah, that's nice.
Yeah, that's nice.
Let's go back up. So what was the question regarding that article? So I read through some of it this morning, bookmarked it. So I have seen it, bookmarked it. I wanted to see if it's something I can address or if it's something I have to get back to.
Yeah, the question is, as a trauma doc, what's your take on it?
So I've skimmed it and I read some of it. So to be fair, but some of it sounds pretty good. Again, I kind of alluded to what some of the points were earlier in that total cases don't always reflect total active cases for a lot of reasons. Those total cases totally reported, and that's what they're talking about in that article to some degree. A lot of it is talking about the reality of active current cases, and some of it has to do with just where we're at and being able to respond to it. But the growth, they do talk about the growth and whatnot, and there's a bunch of curves. So it's something that I was just made aware of this morning, and I will read. So I will look for that comment and try to reply in the next couple of days once I've processed the whole thing. It's a lot of data.
Okay, cool. Hey, this is something that Michael and I were talking about on Tuesday when our shelter in place really went into effect. We live close to a freeway, and we were noticing the amount of trucks on the road. And truck and dog, I don't know why I get emotional about this, but here we are. Just wanted to let people know that us truck drivers are doing our best to get our products to the warehouses so that they can deliver them to the stores. And the profound level of respect that we have, and I'll let Michael.
I'll get on. I'll just get on my soapbox a little bit because a lot of people don't acknowledge it. Truckers are America's infrastructure. They make it happen. And without them, we're in a bad situation. They really do. It really is our infrastructure. So small thing. First off, thank you very much for everybody that's out there still driving and delivering, and also for everybody else, try and make it easier for them. Not only now, but anytime, at any time. And what that means, one of the very simple things you can do is if you're behind a truck and they want to come over, when you flash your lights, that means you are clear. It means they will not hit you if they pull over. That's just one of the small things that you can do to make, truck drivers' lives a little bit easier. And you should just always give them the right of way because they're doing important work. And thank you guys.
I just want to add to that something I've read on Facebook is something I wouldn't even have thought of. Right now, fast food restaurants, dining areas are closed and just the drive-through is open, which means truckers can't go through. So if you see a trucker trying to get some food, do a solid, go get that food for him. Even if you just drop it on not the floor, but drop it and get your 6 feet of distance. But, again, I know that they are trying. I will tag on to that. I know some companies are trying to make big differences. Amazon, I'm sure you guys have seen, Prime's basically gone away and they're only using it for certain things. If anyone knows Elon Musk personally, I'm trying to slide into his DMs, as the kids say, but I DM'd him. He said he was going to make ventilators. I want him to make ventilators. I want him to make respirators he can Apollo 13 this. He's got some of the brightest engineering minds in the world. and the battery power to back it up and finances. So I doubt he's listening, but if you are, come on, Elon, step up. I know you can. And that goes for everybody else that has the capacity to. This is going to be global, and we need the help.
Yeah. Just another feel good comment. Huge props to the caregivers on the front lines, as well as the folks keeping the electrical grid, sanitation, water, and vital utilities up and running.
Yep.
Yeah, absolutely.
Yeah. I mean, just a little insight into our family. We co-parent Michael's kids. Michael's kid's mom works with water, and she is front lines now, and it's a big deal because it means that Marisol and Miguel won't be able to spend time with their mom in person. It's a lot of technology and FaceTime, but we feel that personally over here. I don't know. Is that TMI? I don't know. We're all sheltering in place now. We're sharing our feelings. Okay.
I want to state the obvious here for state the obvious here for everyone. And I know it's been said before, but, even if you feel, we were talking to Dave Spinks, thank you very much, our director in Europe. And, it takes some folks longer than others to shelter in place and appreciate the need to do that. The obvious statement I'm going to make is you're doing it as much for yourself and maybe more so for everyone else. You don't want the responsibility of potentially infecting other people. You don't want to pass it on. You don't want to be a vehicle for the virus to pass on from one doorknob to another, or even physical articles of clothing or other things, even if you're not infected, being the transporter of that. So staying sheltered in place is critical, and you're doing it for everyone else as well.
Okay, we're going to jump back into some specific questions for you, Chris. Any insights on all the suggestions to boost immune systems? This is from Silver Runner, i.e. cold shower therapy, vitamins, cold versus warm air temps, aside from the usual eat and sleep well, exercise, and less stress. Oh, we lost your sound. You are muted. Did we touch? He's got a little slash.
There you go, Chris. Oh, no.
Right. Still not coming through. Did his earphones die? Please hold for technical difficulties. Sorry, everybody.
Okay, is it better now?
Hey, you're back.
Okay.
We got you back.
That was a little commercial break.
The audio was lost. I just switched over. Okay. So I think I heard all that question. Right now, immune wise, Western medicine doesn't necessarily know all the right answers when it comes to what's good for you and what's not, and keeps you healthy. So if it's something you believe in and something you've been doing, I say do it. When it comes to specifics, there's nothing specific that we know of. Vitamin C gets a good rap. You need to have 4,000%. No, most of your supplements are going to get you to about 1,000%. The reality about vitamin C is whatever your body doesn't need, it just pees out. Otherwise, to be honest, it's a virus. They are pretty resilient. So it really just comes down to staying away from each other.
Copy that.
Okay. Oh, sorry. Oh, here's a good one. This is from Dan the Man 2245. My wife is an ER nurse practitioner and is already feeling overwhelmed. She's in Denver. What would you recommend I can do? So what can he do specifically, knowing what she faces each day?
Give her time if she asks for it. Give her time if she looks like she needs it. Let her know blatantly that you are there for whatever you need her to be there for. If she starts talking about her day, let her talk about whatever it is. I got asked the other day by a friend how I was doing, and I let him know I was scared because I am. I don't know what's going on. We know that it could be very bad here, and then I've got my family to worry about, and my wife is here supporting me. She's letting me talk about the same thing 5 times in a row if I have to, because that's how I need to cope. And so, um, just letting her, this guy's wife, or any of your significant others or partners know that you're just there for all these people in the front lines, whether it's to give them their time, be there to listen, support them, understand that they may be short just because they don't know what else to do. We are facing something unprecedented in our lifetime when it comes to medical pandemics here, especially in the US. And nobody's going to be good at handling it. So this is the community part. Reach out to your friends, let them know you're there.
Yeah. Hey, circling back on the immune question, Computer Cowboy says it best: laying off alcohol and other addictions would help, certainly, especially alcohol, what it does to the immune system to dampen it, correct?
Um, in general, broad strokes, yes. A little alcohol in there may actually help you survive it, depending on who you're locked up with, and what you enjoy. Any smoking, of course, is bad because it's going to obviously weaken your lungs ability, and this virus does target the lungs. So that's the only one that you could really pick on. Um, but yeah, anything to excess is bad. Smoking at all is bad. But don't be afraid to have a cocktail, a glass of wine, a bottle,
So
maybe not so much.
moderation.
Moderation.
All right.
Yeah. Besides, you may be stuck inside a long time. Don't waste it all in the first week.
Okay, this one's good. This one's really good. This is a comment, not a question. I'm going to let this comment come through. Please
Okay.
remind people to respect purchase limits at the grocery stores. I talked to a checker today that said he's been yelled at when he wouldn't sell more than the limit to several customers.
Yep.
That checker needs a badge, a medal of honor.
That's right.
People, the food chain's not going to be disrupted. The supply chain's not going to be disrupted. It's going to continue. You just may not be able to go to the store because you feel like it. You're going to go when you need to.
But I need my toilet paper.
Hey, if you're
there's
somebody
more butts
who
out there
needs
than your butt.
50 rolls of toilet paper in the next 2 weeks, you got bigger problems than COVID.
Yeah. Okay, good question related to hand sanitizer. I drive a garbage truck in Vancouver. This is Raymond. Hi, Raymond. I drive a garbage truck in Vancouver, British Columbia. I've really been ramping up my use of hand sanitizer. Will it hurt my hands if I use too much? Is there a brand or type you recommend? You want to plug something?
So there is no brand or type. All the generics are just as good. You have to have a minimum percent of isopropyl alcohol, though. That's the secret. It has to be 60% or higher alcohol based. Most of them have like aloe or something mixed in, and they're good for your hands. And I mean, I use them all day long. I don't even count. But if you think of a typical day when I see 15, 20 patients, I walk into the room, I hand sanitize, I will shake the hand of whoever's in the room, then I hand sanitize again. I then examine the patient with gloves on, take the gloves off in the room, and hand sanitize again. Then when I leave the room, I hand sanitize because we have to gel in and gel out. That's 4 times. So 4 times, even 15, I'm not super good. It's like, what, 60? So that's 60 times a day that I've just hand sanitized, not including whatever else I've gone on. So yeah, you're fine. And my hands, they're still super soft.
Okay, Alex has a good question. Alex Cruz, is it beneficial to gargle salt water or some type of antiseptic in order to clear your nasal passages and throat, thus preventing having a body capable of carrying the virus?
Okay, so that kind of hits a couple things. Your body's always capable of carrying the virus, so you can't really do anything to minimize that. Your mucous membranes are just there. If they dry out, they're not mucous membranes, and therefore you got problems. Um, the virus is there. Gargling salt, even if you do those neti pots and whatnot, or try to flush it out, honestly, it's not really going to do too much. If you are already on social distancing and shelter in place, pretty much as long as you stay in your house, you're fine. It is not airborne to the part where it's going to float across from neighbor to neighbor. It's going to stay where it is. So those people that are in their house, clean. Maybe, if you want to clean once a day, wipe everything down, knock yourself out. That's what my mom's doing, but that's kind of a coping mechanism for her. My brother also is a essential worker, so he is coming and going. But if you're kind of in your house and nobody's coming and going, you're pretty safe.
The Salt Laker says to gargle tequila.
Yeah, I mean, alcohol will kill it. Let me see, tequila at 120 proof, though, is only 60%. That's about as good as you get. You got to be at least 120 proof.
That's funny.
Right.
Let's see. People are still here. I'm going to scan through real quick, see if there's any questions I missed.
Okay. And then I'm going to talk about, again, just underscoring our position on Rally Point, that we do use that. It's software out there that is meant for the sole purpose of getting our community together, whether it be for a Rigs and Coffee type meetup or a trip. And we're asking and encouraging everybody to not do that. So that's not how we need to be using Rally Point right now. We have left it live so that people can coordinate virtual and online meetings.
We'll have more about that.
And we'll have more information on that. And to that end, you guys know we've been endeavoring to kick out more content to keep us all occupied about, things that we like to do. We won't always be talking about COVID-19. We'll try and keep the content coming to you guys. But you can always reach out to either myself, Corey, or Chris over there on our forums if you want to stay connected with your community and other people within the community. So please take advantage of that. We're spending more time online these days.
I do. The forum stuff is harder for me just because of limitations. But if you wanted to go to the overlandbound.md Instagram, my page there, and message me that way. I don't care if you follow me or not personally, but if you want to message me, those I will respond to, usually in live real time if I can.
Great.
Okay. Hey, Rob Irwin. Hey, Rob. Environmental surfaces and the lifespan of the virus on them. Go.
So right now we think, based on just classroom experiment, 3 hours in the air, can't do much about that. Surfaces, copper and steel, are up to 3 days. It used to be 7 to 9 hours. We think possibly 3 days. However, and this is going back to the article as references, we don't know what the contagious factor at 3 days is right now. I haven't seen any numbers related to that. They just know at 3 days, if you swab, it's still there. May not be enough viral particles to actually infect you. But basic stuff, 409, 10% bleach solution. Do not go crazy. There's an interesting phenomenon that if you put more than 10% bleach in a solution or create 10%, that it actually creates a ball around these things and protects them and doesn't kill them. So 10% bleach solution. And otherwise, environmental surfaces, just, if it's your own house and you wipe them once a while, like normal cleaning, you're good. If you're out and about, try to wipe them down as often as you can think about it.
Hey, here's a good one, and it's two parts in my head. It's, first of all, from Raymond. My wife works in an office, and one of her colleagues sells water ionizers and promotes the health benefits of ionized water to help combat COVID-19. I think it's all BS. Is there any truth to this? And the second part of this is, where should people look for the information they need that is correct, accurate, and sane?
Okay. So ionized water. The most politically correct way to say that is that there are no studies to show that ionized water is going to be effective against the coronavirus.
Good job.
So that is it. But the placebo effect, if you think it works, it works. Go for it. That's the placebo effect. But nobody supports that. The second part, was, I already forgot. I got distracted on my own head.
Oh, where do people go for information?
Oh, so that one's a little trickier. Usually, the CDC information is pretty good. I'll probably take some heat for this, but I will say that the CDC is decreasing their recommendations for healthcare providers from what they consider an airborne risk to a droplet risk was probably motivated by lack of supplies to protect us against airborne stuff. And they couldn't continue to promote that because we know it's airborne. But for regular non-medical professionals, the CDC website I looked at a couple of days ago is pretty accurate. But it's really basic stuff. Don't wear a mask unless you're sick. Don't need an N95 for any reason, even if you are sick. Wash your hands. Stay away from people. That's all you gotta do.
All right. Well, hey, Chris, what would you say to people who are feeling scared or have a certain level of anxiety about the current state of things?
I would, first of all, not say you're a bad reporter. Let me just start with that. But I will say that is acceptable. Be scared, and it's okay. I'm scared. It's okay to be scared. Don't worry about being scared. We don't have enough information to make you feel better. But with that said, if you follow the basic recommendations that are being put out there, avoid people, wash your hands, take normal precautions, most people will be fine. Large percentage of the population will be fine.
Okay. We're at time. Yeah.
Yeah.
Time.
I want to,
that flew by.
we can continue the conversation in the comments, everyone. We're live
I'll keep
now,
an eye as best I can.
Yeah, but as Chris has time, clearly his plate's very full. But we can continue the questions in the comments and the discussion in the comments. And like I said, of course, over on overlandbound.com, we'll be on the forums.
Okay.
Trying to connect people virtually and online.
And I'll just say that typically with the live, anything we do live, the numbers of viewers will fluctuate and it'll go up and down. And this has been consistent the entire time, which is
People
really
are stuck at home.
great. Yeah.
Yeah, let us know
Captive
if you guys.
audience.
We can do more live streams, and we probably will in the coming days on various topics that come up.
And he's gonna make videos, just a bunch of videos.
Yeah.
And keep posting them up. And Chris, we'll get stuff from you and get updates too.
Yeah,
we're all here for a while.
Ones are, what do you really need at home? I mean, let's talk about what kind of first aid stuff you really need if you're going to be stuck at home. We can talk about basic. We're all campers here, but basic supplies. You don't need a month or 6 weeks of stuff, right? Yeah. So yeah, we can do all kinds of stuff, and I'm hoping that things just kind of remain steady. So I should be available.
All right, and I'll try not get to get down to the how to clean your Coleman stove video. I'll try not to go that far. We'll try and keep it interesting, you guys. All right, Chris, of course. Thank you very much again.
Happy to help.
Yep.
Yeah.
Great.
Yeah.
Okay, everyone. Stay safe.
Thank you.
Stay out of the public as much as possible.
Wash your hands.
Wash your hands.
Wash your hands.
We will
stay away from people.
We will see you all very soon. Thanks for hanging out.